So tonight I'm going to do a quick video on unalive thoughts, which is what somebody had written to me. And I'm taking a guess that that means suicidal thoughts. September is the perfect month for me to talk about this because September is Suicide Prevention Month and unalive thoughts. I'm not quite sure what this person wants to hear about suicidal thoughts. I'm just going to give some general suggestions because I don't know what's going on. So my first thought is, if you're struggling with dark thoughts or suicidal thoughts, know that that's okay. That to some degree it's normal. We all at some point in our life have had suicidal thoughts or thought of not being here. At the point where you're starting to really think of acting on them, or you have a plan, that's when I would definitely say go to the emergency room, seek professional help. Do not wait for those suicidal thoughts to get bigger in your head. Definitely go see a professional. So first, acknowledge that they're there. Do not be ashamed. I have had many clients feel very uncomfortable telling me about suicidal thoughts because they feel like I'm gonna have them hospitalized or escort them to the psych ward. Now, the way that suicidality works in mental health is you could talk about your suicidal thoughts. The only time a professional will have you involuntarily hospitalized is if your therapist truly feels you're at imminent danger. What that means is if a client has a plan, they have intent, they have ideation, then at that point you leave the therapist no room but to act on having the patient hospitalized. But we do understand as therapists, and we are well trained to know that when people talk about dark thoughts, unalive thoughts, suicidal thoughts, that to some degree it's going to come up. We are prepared for that. We know how to assess and evaluate. I tell my patients, again, I can't speak on all mental health professionals or all therapists, disclaimer, this is just basically me as a therapist. When clients talk to me, I encourage them to talk about it. Talking about suicidal thoughts does not necessarily mean that it's going to make those thoughts bigger and it's going to cause somebody to commit suicide. So that is something that a lot of people have a misconception about. A lot of parents avoid talking about suicidal thoughts with their kids or their teens for fear of it's going to amplify or magnify those thoughts. If anything, it takes away the power when people have a safe space and a support to talk about them. So if you're struggling with suicidal thoughts, if you feel that you are having them, to some degree it's normal. I'm normalizing it because I think we need to reduce the stigma surrounding suicide. People do have them. I have had suicidal thoughts. Everybody I know to some degree has had suicidal thoughts. It's when you want to act on it or you have an intent to act on it, then that's where it becomes a danger zone. And that's where you need to go see a professional. I hope this answers that quick question. If this person or if anybody has more questions about suicidal thoughts in therapy, please let me know. But feel comfortable to talk about dark thoughts or suicidal thoughts with your therapist. They're not going to automatically hospitalize you. I know a lot of people have a big fear of, well, if I talk to my therapist or if I tell my therapist, then they're automatically going to hospitalize me. That's not the case. The only way you will be automatically hospitalized is if your therapist fears for your well-being and they're concerned that you may actually kill yourself or cause harm to yourself. Other than that, we know there are moments where people feel like, I don't want to be here, or sometimes I wish I didn't wake up. And it's okay to talk about those thoughts in therapy. So I hope that answers a little bit of your questions. I'm going to try to get more into having more of these little clips to kind of help people get better understanding of things, okay?